At the beginning of the global pandemic, it did look like Africa was being spared, showing fairly low case numbers, but that situation has quickly changed. The World Health Organization says infections are increasing rapidly on the continent, and it expects the situation to worsen because of the slow vaccine rollout. Let's talk now to Owen Kaluwa, who is from the WHO in South Africa. Thank you for your time. Part of that slow rollout surely is the responsibility of COVAX, the place where we think the World Health Organization had enough influence to ensure significant distribution to the developing world. I think you might be on mute, Dr. Kaluwa. Would you mind? Thank you.
Thank you very much. Indeed, you're correct. The number of new cases of COVID-19 and deaths are increasing in the African continent. And as a continent now, we are in fact in a resurgence. Yes, the COVAX was supposed to have delivered a number of doses by now, but the problem really has been with the global supply of vaccine, making them available even to COVAX and also to other countries. As you are aware, most of the developed countries, some of the developed countries, I should say, have stockpiled vaccines or bought ahead a number of doses of vaccines, making the global supply of vaccines inequitably available to countries.
But does that mean that the WHO is pretty much a toothless organization when it comes to dealing with a pandemic that is as serious as this one? You can't really influence that situation in any way?
Well, WHO has been working also together with other partners and also discussing with various developing countries, and a number of them, as you might be aware, are going to make some of their doses available not only to COVAX but also to some of the countries that are the developing countries.
Let's talk about the continent now. Where is the situation most dire? We know that obviously South Africa has a particular problem. Where else on the continent are we experiencing serious difficulties at the moment?
Okay, let me say that as a continent, as I said earlier on, we are in a resurgence, but most countries are seeing either a plateau or a decrease in new cases. But the trend is not uniform. At the moment, there are 10 countries who really have met the criteria for resurgence. And these are Algeria, DRC, Eritrea, Liberia, Namibia, Rwanda, Sierra Leone, South Africa, Uganda, and Zambia. So these are the countries really where the situation is much more serious in terms of number of new cases.
Now, I know that the WHO has approved quite a few vaccines for emergency use, one of them being the Chinese Sinovac. How do those vaccines perform when it comes to variants like the beta variant in South Africa? Does the WHO have information about the performance of those vaccines?
Well, the WHO evaluates those vaccines, but by and large, the vaccines, the level of efficacy or protection that WHO has looked at is for vaccines that are 50% and above. And they evaluate the data according to that and also according to safety issues, and then they are able to put them on emergency use listing. But the data around the beta variant as regards the Sinopharm vaccine is at the moment fairly limited. So I think because of that, it's very difficult to pronounce how well the vaccine, that particular vaccine would work against the beta variant.
So, okay, so we don't have information about how it performs against the variant that is common in South Africa. We keep hearing, though, that the fewer people that are vaccinated, wherever they are in the world, the more likely that more serious variants emerge. Apart from the beta variant that's common in our country, are there other variants of concern in the rest of the continent?
Yes, there are a number of variants of concern. The Alpha variant is a variant of concern. Of course, the Beta variant And then the Delta variant, which is the variant that was first identified in India. So these variants have been identified in a number of countries within our continent as well.
Where in particular? Can you give us an idea? Because we obviously hear that the Delta variant is a very, very significant fast spreader.
I'm sure you're aware that the Delta variant is there in South Africa here. The Delta variant is also in a number of countries like Uganda, countries like Malawi, like Zambia, and there are a number of other countries that do have Delta variant.